Thanks, everybody.
Just remember, we're available for all of your research needs, and we do weddings and bar mitzvahs too.
You may notice that I'm not Dr. Torelli. I am Emily Coe, Senior Director of Clinical Content at EviCore.
There is an industry focused on quality assurance, and that requires keeping up with the literature, keeping up with the advances, summarizing it, providing guidelines for those in clinical practice.
Really, the key with what we do is to take a look at that literature, see what is out there involving, whatever that new thing is, and determine if it is appropriate at that point in time.
Our goal at EviCore is to ensure that the patient is receiving the best evidence-based clinical approach to their functional outcome, their condition, and ensuring that they're receiving the best care possible and that they're responding appropriately.
You're taking all these steps to prevent infection in schools and in the community, and people were a little bit reluctant to bring a well child into a doctor's office with the thought that that's where sick people are, right? And even though practices were doing a great job with infection control procedures and masking and separating sick and well children, people did have that reluctance to bring well children in.
What essentially COVID did for us is accelerated that pathway to adoption as well as implementation of telemedicine platforms and access to care to telemedicine.
The definition of where acute care finishes and post-acute care begins is blurring. And I think that's actually a great thing, right? Because it means that more and more we're able to shift treatment both for post-acute care and even acute care into the home where patients are more comfortable.
We hear a lot about burnout for social workers because it can be so emotional and just hard on folks who go into this field because you are caring in the first place.
I always tell my team, I said, you have to take the small wins. Okay, sometimes if you're constantly waiting for the big full picture, the magic, you might miss the really, really small things.
And we have special guest Tater Van Lannen. Hi, Tater. Which makes this off the rough, not necessarily off the cuff. I botched that joke.
Will we be known as the Site of Care Sisters?
Yeah.
Right.
We'll call you SOCS, Site of Care Sisters.
Very cute.
Okay.